I'm Kinsey Strine, and I'm going to be talking about care navigators and breast cancer. So a care navigator is a professional that helps guide patients through the healthcare system, and they basically just give like the patients like the best possible outcome for like whatever their medical reason is that they came into like the hospital. And a lot of care navigators do tend to be like registered nurses working with doctors, just to like help find the best outcome for their patient. This could also be like physical therapists trying to like get the body and like bones back to like moving properly. So breast cancer is a cancer that originates as like a growth of a cell in the breast tissue. So anyone can get breast cancer, but it is more common in females. And I found 3 articles that talk about like breast cancer and how care navigators help assist these patients to like get better and to like learn more about like the cancer that they have. So the first article I found was from the Mayo Clinic, and it was titled Breast Cancer, and this was published by the Mayo Clinic staff in 2026. And this article basically talks about just exactly what breast cancer is, and just like some statistics on like the amount of people that have breast cancer in the United States. And it also talks about like signs and symptoms that you may be experiencing in the body, so that you could potentially go to the doctor and like get screenings and like see if you do have breast cancer, or if like you're experiencing some other symptoms for something else. And this also just tells you how like care navigators will like help you and like assist you throughout this whole process, from like the time you walk into the clinic and then until like you leave the clinic. And they will also help you like find ways to like prevent this cancer from like reoccurring, which is definitely very nice, because when you get cancer, like you obviously don't want it to come back. So like finding like the best outcome for like a non-reoccurrence is like definitely very good. And the next article I found was from the American Cancer Society, and it was titled Patient Navigators in Cancer Care. And this was published in 2026 by Gloria Rosen. And this article talks a lot about how care navigators can also be called cancer navigators if you do have cancer. And basically these cancer navigators are focused mainly on helping individuals that have cancer, like with diagnosis and like treatment. And then this individual is like very important to help like their patients know exactly like what to expect going through these treatments, and like to find them better ways to get their body back to normal and to help with their physical needs. And this article is definitely very beneficial to individuals that are experiencing breast cancer or any type of cancer, because they are like extremely trained in like this type of cancer, and they know how to like properly care for these patients, and they're not just like regular nurses that focus on like pediatrics or like other parts of the body. They are mainly focused on cancer. And the third article I found was called Breast Cancer, and it was from the Cancer Foundation, and it was published in 2024 by Lily Shockley. And this article talked about just like how breast cancer can be invasive, and how it can like spread to other parts of the body, like the lungs and the brain and even like the heart. And basically it just talks about how like you should rather have like your cancer like stay in one area than have it like metastasize to other areas of the body, which makes your cancer treatment a lot harder. And it also just talks about signs and symptoms of breast cancer. So like you could get like a lump on your breast, or you might be experiencing like a lot of fatigue, or just like some other issues. And these are all like very important to know about, so you can tell the doctor like what you have been experiencing, so they can try to like go through all the signs and symptoms and like process like what you're going through versus like what an actual cancer diagnosis might be like. And this article was definitely very important to find more out about like breast cancer, and just how to be like more mindful about like knowing if your body like is functioning right, and like to help you find ways to like stop your spread of cancer like within like the healthcare field. And patient navigators are very important for like stopping metastasis of cancer, because if it does spread to other parts of the body, then this will make like your diagnosis like a lot harder, and it can increase like the stages of cancer that you have. And like the higher the stage of cancer you have, the more difficult it is to like treat and like get rid of. And so it's definitely very important to get rid of your cancer as soon as you can. And I just think care navigators are very important in my opinion. And I'm glad like they are here to like help the sick patients and get better and like back to like their normal self, especially after experiencing like hardships when dealing with like cancer or like any other types of like diseases or illnesses or like injuries. And they're definitely like extremely important to just like help the individual mentally as well, because even if you are like sick, like you might be like experiencing symptoms, but also you could be experiencing symptoms of like depression and anxiety because of everything that's going on. So they are also there to like help make sure like just all over functions are good.